So we're going to move right along. Our next presenter is going to get into the whole issue of global health equity landscape. I'd like to introduce Kris Bennett. Kris currently serves in a global role as the Director of Prostate Cancer Health Equity Initiatives at Movember. All of his prior work experiences have centered primarily around health equity, health disparities, and intersectionality. He has worked in the nonprofit world within community health centers, homeless services as a consultant, and in the political sector. Kris has an undergraduate degree from Lesley University, a master's in management from Durham University in the UK, and a dual MSW MPH from the University of Alabama. His work in public health and policy space, Kris played professional basketball around the world. When I first spoke to Kris, he was sitting in a chair, didn't realize how tall he was until I saw him and realized he did have a basketball background. Kris?
I'll sit, yeah, I'll sit down. Perfect. Thank you so much, Ken. I appreciate you. So I was going to jump into kind of slides, but I figured this actually might be a more applicable kind of conversation to just kind of have with the audience and just kind of read from my notes just to make it a little bit more personal and kind of just connect with folks. So again, good morning, everybody. Thank you. I appreciate that. Thank you for saying it back. I love when folks do that. So I am truly privileged and honored to be here. I really want to thank the folks over at Walnut Foundation for everything that you all are doing. Thank you for bringing us all together and for all of the meaningful work that you continue to do. I think it's a testament to see all the folks that you were able to bring together in this room. And I think it really does shine through that you are such a respected and just really trusted organization in this space. So anytime I get the opportunity to kind of speak about health equity or get a request, I'll be honest, I'm a bit hesitant. And it's not because the work isn't important, but I think as most of us in this room kind of understand and get, health equity and health disparities are sometimes viewed as trends, more of a moment and less of an actual movement. And unfortunately, oftentimes there isn't much of an understanding of the significance of this work, let alone the support, appreciation, or readiness needed to kind of conduct and implement these efforts. So these talks can sometimes feel very performative. And sometimes it just feels like we're just checking boxes when we have these types of events or conversations, right? However, when I think about my very first conversation with Ken, Tony, I reflect on how in only about 5 minutes of kind of hearing the work that you all were doing with Walnut Foundation and everything you stood for, everything you stand for, everything that you do in your work, I was just about ready to run through a wall. And to be honest with you, that's exactly the kind of passion and motivation I need as an ex-basketball player, right? Like I need that kind of stuff. So thank you for that. But in all seriousness, there was really genuinely a sense that the work that you all have done and organized was very intentional, organized, and meaningful. And I don't know everyone in this room, but I would venture to say that almost all of us here doing this work feel the same way. And I know that we're all playing our parts in this very complex kind of web of things that we're doing to address the needs that our community are calling out. So we also all recognize that prostate cancer, especially prostate cancer health equity, is not just about the numbers and statistics. It's about human lives. It's about families. It's about our communities. Prostate cancer is often sometimes seen as a disease of older men, that if you live long enough, I'm sure we all hear this, right? If you live long enough, you're going to be diagnosed with prostate cancer. But for many, particularly in our communities, right? Communities that are historically and intentionally excluded, those disparities, inequities, and challenges that exist throughout our prostate cancer journeys, whether they arise at a micro level or a macro level, are even more profound and pronounced, right? They often lead to, and rightfully so, that severe distrust and mistrust of medical communities and the services that we all have, right? And I'm genuinely reminded of this anytime I kind of get to reflect on my experiences on the road and in communities across the United States. So a quick story for you all. Actually, A few years ago, I was genuinely lucky enough to have been asked to speak about prostate cancer in Black communities at Emmanuel African Methodist Episcopal Church in Charleston, South Carolina. For those of you that might not know, this is the same church that was years before tragically the site of an unthinkable hate crime. After I got to have my conversation with folks and did my speech, I was able to sit down with some of those constituents and folks of the church. And I had a conversation with a gentleman named Lee. I love Lee. He is somebody that I still talk to this day. But after that conversation, after that kind of church conversation, I sat down with him and Lee shared a lot of his experiences with me. He shared about his life growing up in South Carolina as a Black man. He shared about his family. He talked about how his wife makes the best shrimp grits that you'll ever have. He talked about, his time in the Air Force and all the places that he had seen, all the places that he had served. He told me about, everything in his life. And of course, we got to football and we got to basketball because that's what men do, right? And then we finally got to those conversations about his health and where his kind of journey had taken him. And he told me that he never thought he'd be diagnosed with prostate cancer. He shared how his father had been diagnosed with cancer and unfortunately died at a young age when Lee was a child, but that his family never actually spoke about it. In fact, Lee shared with me that when Lee was diagnosed with prostate cancer at the age of 43, his great uncle was actually the one that told him that prostate cancer was what his father was diagnosed from and eventually died from. He told me about his prostate cancer journey. And honestly, it's sad, but probably not something that most of us in this room would be shocked to hear. He talked about those challenges of being able to afford care. He talked about the barriers of getting a PSA test, talked about his struggles of having to coordinate transportation to appointments, told me about how he felt like he couldn't be a provider to his family because of this disease. Talked about the complexities of kind of navigating the medical systems that exist in the United States, and talked a little bit about how he really didn't get a good understanding of how to understand how to kind of navigate those things, and told me about the limited amount of support that he actually had. And then he kind of opened up to me about many of those other inequities and kind of barriers that he faced as a Black man navigating prostate cancer. And then he shared something that has genuinely kind of like stuck with me throughout all of my work and everything that I do and everything that I kind of view my work through. He told me that his wife and his children not actually pushed him to actually see a doctor, that he wouldn't have gone because, and I quote, "I never trusted them. They never cared about me. I would have rather taken my chances alone to have gone in and dealt with those doctors." His distrust and fear from previous experiences and interactions with the medical system and his past providers almost caused him to bypass a PSA test, unwillingly ignore this disease, So unfortunately, like I said, my friend Lee's story is it's far too common, right? It's far too common. Stories like Tony's are far too common. Globally, prostate cancer is the second most prevalent cancer in worldwide, in men worldwide, with an estimated 1.4 million new cases annually and nearly 375 deaths each year. These numbers are absolutely staggering, but it gets scarier when you think about how the burden of this disease is not shared equally. In high-income African countries are more than twice as likely to die from prostate cancer compared to their counterparts in the US or in Europe. And prostate cancer is the most common cause of cancer deaths among Caribbean males. Even within high-income countries like Canada or the US, significant disparities still exist. In the United States, Black men are about 1.7 more times likely to be diagnosed with prostate cancer and over twice as likely to actually die from it compared to their white counterparts. This This disproportionate burden is the result of a mix of genetic, environmental, and systemic kind of factors. Health, regardless of where they live, regardless of their socioeconomic status, regardless of their race. When we talk about prostate cancer and prostate cancer health equity, I like to look at it in three buckets, addressing access to care, cultural sensitivity and understanding and treatment, and also research gaps. So we know that early detection through screening can dramatically improve survival rates. We heard a little bit about that in Tony's story. I kind of touched on that a little bit in Lee's story. However, men in rural and underserved urban areas often lack those types of screening programs. And so this is particularly acute in communities of color, where again, distrust of the healthcare system can also deter men from seeking that help. Culturally, tailored care is also something that's essential for fostering trust and improving health outcomes. And community-based interventions like the many that you in this room are working on or are a part of that provide that include community voices, address those types of barriers identified by community members, and respect those types of cultural differences that have been shown to not only significantly improve those screening rates, but also the adherence to treatment in many populations, because we're able to better understand how folks prioritize their health behaviors. And then finally, historically, clinical trials, and we'll hear a little bit more about this later on, but historically, clinical trials and research studies have significantly underrepresented racial and ethnic minorities. This has led to treatments that may not actually fully reflect the biological diversity of patients worldwide. We need to invest in research that includes these populations to develop more effective and also equitable treatments. Thankfully, we are seeing progress in closing these gaps. On a global scale, partnerships between governments, nonprofits, and healthcare providers are key to delivering sustainable change. Some initiatives, like the ones that I'm very, very lucky and fortunate to work on here over at Movember, including our Prostate Cancer Health Equity Grant, have been able to provide vital funding to support these targeted interventions in historically and intentionally excluded communities. And that's globally. Other work that Movember is doing to address these disparities in prostate cancer space globally can be seen throughout our work across 6 prostate cancer initiatives that we focus on. So I know that I have some slides up here, so I'm just going to kind of click through these, and I want to get to the 6 initiatives so I can just share those with you. No worries. Thank you. So I'll tell you when to keep going. One more. And then actually, can you go to the one before? Just so I can, one more. Yep. So I just wanted to, again, quickly point out some of the things that Movember is doing on our prostate cancer side. So the first thing, which I think is really important to kind of share, is our portfolio aims. I love this because it's very clear and concise, and I think that is one of the best things we can do to kind of demystify the work that we're doing. So our portfolio aims are, 1, to improve prostate cancer mortality and reduce the number of people that are progressing to and dying from lethal prostate cancer. And then the second is improving quality of life. So we really want to drive the delivery of consistent and personalized cancer care that it reduces the variation in prostate cancer care treatments and outcomes, and also reduces the number of people experiencing severe and bothersome long-term side effects. So next slide, please. Thank you. These are the 6 initiatives that we are working on here at Movember that I think are very applicable to everything that we're going to be having discussions around in this during this kind of conference. So the first bucket that I want to talk about is kind of the personalized active surveillance. So that is really developing personalized and risk-adapted approach to active surveillance. So, we kind of talk about healthcare and we kind of talk about prostate cancer care. And one of the things that I often hear is it's really hard to get people to do these types of things. And I always say, you know what? Healthcare in general is not a one-size-fits-all kind of approach, right? We need to tailor those types of things. And so that's exactly what the personalized active surveillance is doing. The next thing is preventing disease progression. So again, that's kind of working on developing those biomarker-informed treatment strategies to prevent high-risk prostate cancer to those fatal disease. Then we have the health equity bucket, which is, of course, the one that I'm working on. So we're working to reduce inequities and disparities in outcomes by generating new knowledge and accelerating implementation. And then on the personalized cancer care piece, again, that is something that we're working on because, like I said before, this is not a one-size-fits-all kind of bucket. So we're working to optimize and also monitor and manage the prostate cancer and personalized cancer care models. The last two, that next one is clinical quality. So we're accelerating real-world use of clinical quality data to improve healthcare and also those outcomes. And then the last piece is sexual health and well-being. So we're working to really help address kind of those sexual health pieces that come up from patient to patient. So, and I'm all set on that. So thank you so much. I appreciate you. So with all of that kind of being said, my calls to action to folks in this room are really to just let's unite to really change the face of men's health, right? But not just men's health, prostate cancer health equity overall. So by fostering cross-functional collaboration, we can really break down barriers and ensure that every man, regardless of their race, regardless of their background or circumstance, will have access to the best care and resources. We have to build trust. We have to continue to build trust within our communities. We have to continue to advocate for open conversations and equitable solutions that address the unique challenges men from historically and intentionally excluded communities face in their fight against prostate cancer. Together, we can reshape the future of prostate cancer and make health equity something that's tangible for all men. There's still so much work that needs to be done. As advocates, healthcare providers, policymakers, we must take a stand. Our goal is not just to reduce mortality, but to ensure that every single man has an equal chance of life-saving care, dignity, and a better quality of life. As I think about this collective group in this room or online, everywhere really in the world, I genuinely am filled with hope, joy, and a ton of optimism. I firmly believe that although it might not be the folks or the generation to completely eradicate prostate cancer, we certainly will be the collective that sparks the minds that do. This is slow work. This is often work that is thankless. And this is really, really hard work. But it's work that saves lives. It keeps communities healthy, and it truly empowers people and centers folks as more than just a patient. This collective focus and commitment to health equity is going to ensure that we aren't doing this work in silos or doing this work alone. It ensures that we're actually co-creating with the communities we work in, that the folks closest to the pain actually have the power, and that those community aspirations of equity are more than just a dream, but a reality. As my time here comes to an end, and my asks for you kind of jump a little bit more, I hope that each of you here today thinks about how we can work together to build a world where a person's chances of surviving prostate cancer are not dictated by their race or their income or where they live, and that together we can, we will, and we must create a more just and equitable future in prostate cancer care. Thank you.